Hi, I'm Dr. Greg Handel. I've been working postdoctorate in the field for well over 30, 35 years, um, through a whole range of populations and different settings, both residential, even early on institutional, but lately private outpatient patient practice. I really believe that counseling should be goal directed. Um, I think venting has its place on occasion, but I will tell all the people I work with, I'll let you vent for a session, maybe two, but we really need to set up goals and we really need to feel that we're working in a direction. So that's really, really important that there's value in the session itself and that we feel like these sessions are moving in a direction and helping the client get better in whatever way they want to achieve. It's important to analyze the behavior to identify what behaviors we're talking about that are an issue, what emotions or feelings are in question that we want to work with and deal with, and then find out what are the triggers to those emotions, what patterns are developing, and then how do we want to change those patterns. Sometimes the incentives that we use may be detrimental, and those are the things we need to change. So that's more the CBT or cognitive behavioral therapy, that approach, looking at what are the things that have triggered the behavior in question, what are the consequences or incentives of those behaviors, and then how to change those patterns so someone's adapting a more healthier pattern that will help them. So we talked about patterns, and we get stuck in these patterns. And if we could change these patterns on our own, we probably would. Sometimes we do. We know, people can quit smoking on their own. Sometimes they can't. Sometimes people may find they drink too much and they want to cut down on their own. Often they can't. There are a lot of different behaviors. There are blind spots that we have in relationships where we develop in a pattern of reacting to one another. And if we could change them on our own, we probably would have. And it's often very helpful to have somebody on the outside, someone who's trained, someone who will look at these patterns and then work with us in a non-judgmental way to change those patterns. I've talked to so many people who come into therapy because their spouse recommends, or their sibling, or some very important friend in their life recommends they seek counseling, and they didn't know what good counseling would do. And then after a session or two, they're like amazed, wow, this really helps so much, because of just having that little direction, just having that outside input, that kind of redirection. If you think of a body in motion tends to stay in motion unless an outside force changes it. Well, that's often how we are with our behavior. Our behavior gets on these patterns and on these directions, and the motivation keeps us in that direction until some outside support can help us to change and help us move into a different direction.